Hi everyone. So in today's world, knee replacement is a common surgery. People or any patient is worried about what complications I get. Will it need to be replaced again? How long it will survive? This is the common questions in the patient minds, and they will wait for long and long. They will delay the things also. Yes. So once well done surgery, there is no need to repeat it again. So surgery is for long lasting. It is not like 10 years or 15 years duration. People will say that. There is a timeline. Most of the people will think for the surgery. It's not that, because there is a metal inside and the plastic is also there. So the wear and tear will happen on the plastic. So life of the implant means the plastic wear rate. What will happen if the plastic is worn? We can replace with another plastic. It's not entire implants need to be removed. That's a common myth people will have it. So it's a well done surgery. Right now today's plastics what we are getting is they are giving for 25 years. Mostly it will come for lifetime. There's no need or there's no such cases in India, in the Asian community, because our people will come at a very late stage. So worn out rate of plastic is nil. So once it is done perfectly, it is for lifetime. There's no need to repeat the surgery again. And we'll think, what are the common complications with the surgery? Yes, no surgery is complication free. Every surgery, apart from orthopedics or general surgery or abdominal surgery or brain surgery, everything respect to their part depends upon the patient condition. The complications will vary. So when the patient is, this is like a elective surgery, means we'll plan everything. What are the implications we have? We'll try to assess the patient whether he's fit or not prior to the surgery. Then we'll go after the risk assessment. If he's safe side, we'll go that. But some unsafe period is also there for every patient. Depends upon their comorbidities, means diabetes, blood pressure, heart patients. So these people, if any either ailment is there, they can carry risk. The risk rate is also increases with age. Year by year, the risk will increase. It never becomes risk free, because people who doesn't walk because of pain will carry long risk than the people who are walking. Not walking is not an answer for an arthritis. To lead an active life, walking is more important. Coming to the surgery, there are certain common complications for any surgery. Means we need to open body tissues. We need to cut. The infection is the biggest risk factor for any surgery. And in orthopedics, because we use lot of metal inside the body, infection is the biggest risk factor. That is why worldwide, if it is the best hospital, the infection risk is 2%. There is never zero for anything. So 2% out of 100, 2 people can get a infection. Depends upon their immunity if everything is normal. So these people are very difficult to assess. So a lot depends upon the immunity. So for these TKRs, to prevent these complications like infection or a DVT or a loosening of the implant alignment, these are the common risk factors or complications we will see after the surgeries. So to rule out, to keep the infection at low, we need to take certain precautions from both patient side and doctor side also. So these specialized theater should be there, in time antibiotics to be given, and we need to check all the sterility factors, and properly staff is also should be motivated. We need to cut down visitors to the room, because outsiders, if they are immune also, the patient is not that immune. So it all factors on the hospital factors and patient factors also. That's why we need to take certain precautions strictly to prevent infections. Infection is the biggest source. Multiple sources are there. We need to cut down as much as possible so that patient goes safely. So knee replacement is a precious surgery. There is a possibility of infection, but we need to take care and cut down all the sources of infection so that patient can go safely. I can enjoy that. What will happen if infection comes? Yes, there is a possibility to get the infection for some people. If the proper precautions are not taken, or patient immunity is not good, or sugars are high level, it's not under control. So there are multiple factors can act on that. If a early infection is detected, some fluid discharge is there, sometimes bloody discharge will be there, then we need to cut down with the antibiotics. Most of the infections will come down with certain amount of certain duration of antibiotics. If it is not, if it is long lasting or 2 months or something, generally we'll take the patient inside. Again, we need to clean it as early as possible to reduce the bug inside and top up with the antibiotics. Most of the infections will settle down. But late infections, there is a possibility even after 2 years also, because the immunity is fighting, but at the end of the day it hasn't resulted. After 2 years also, the possibility of infection is there. It is usually diagnosed with a PET scan and patient factors, patient condition, skin condition and symptoms and blood parameters. Once we prove that there is an infection, patient need to go for surgery again. We need to pluck out all the implants what we are put inside. Then in a second stage, after certain period, means 4 weeks to 8 weeks, we'll wait for the infection to come down. In this time, we'll remove all the implants. We'll keep some cement spacer inside to not to collapse the space inside. So we'll give the antibiotics for certain time limit, depends upon the bug. Then we'll see there is no infection in the body. Then we'll re-implant other new implants into the body and make them walk. It is like an infection revision surgery, what we say, 2-stage operation. And other complication is like everything boils around alignment. How do you get that leg straightening? Most of the people will come with bow legs, not a straight legs. So operation means creating that alignment perfectly so that they can walk perfectly, less impact on the back. So that is gives a longevity. If it is perfectly balanced, well done surgery, there is no need to look back for lifetime. If any element is wrong, then it requires the implant wear and tear rate will be not equal on both sides. There is a lot possibility of wear on one side. The implant get loosened like a seesaw mechanism. So there is a possibility for another surgery at early stage. So we need to revise it again. That is called loosening of the implant. Other complication is DVT. DVT means blood clots in our veins, in the blood vessels. There is a possibility of blood clot because it can be common in high obesity people, high BMI people, and previous other complications, or people who suffered with cancer. And there are certain risk factors to rule it out. And most of the people who are not walking or bedridden for a long time, there is a high possibility of developing blood clots in their blood vessels. So we'll do a scan, but routinely we'll give, for all the patients, we'll give a precautionary medication to prevent this DVT. So with a blood thinner, it can be cured, but there's a certain time period you need to use this after surgery, even for a normal person also. That's a routine protocol for us. So doing the surgery in strictly adhering aseptic manner, that gives the longevity and can rule out the infection. And attenders or also visitors should be restricted initial periods. That's important step because they can carry any virus or bacteria also. If the patient weak immunity can create a hazard also. That is where we need to restrict it. Thank you.